What if I told you a small, often ignored condition could quietly steal your confidence, your energy, and even your future fatherhood? Today we're talking about something most men avoid but shouldn't: varicocele repair. This isn't just about a medical condition, it's about control. It's about understanding what's happening inside your body and deciding you're not going to ignore it anymore. Pain, discomfort, fertility struggles, these aren't things you just live with, they're signals. And when you act, when you take responsibility and face it head on, everything changes. This is your moment to stop delaying, stop guessing, and start fixing what matters. Because your health isn't optional and neither is your future. Awareness before damage starts with understanding what a varicocele actually is and why it matters more than most men think. It's not just a minor discomfort or something you ignore because it doesn't always cause sharp pain. It's a condition where veins in the scrotum become enlarged, leading to increased temperature and disrupted blood flow around the testicles. That silent change can begin affecting sperm production, testosterone levels, and overall reproductive health long before you even notice clear symptoms. Many men walk around unaware, assuming everything is fine, while gradual damage continues in the background. Awareness means paying attention to small signals, like a dull ache, heaviness, or visible swelling, and not brushing them off as normal. It means recognizing that early stages are often the most critical time to act, because the body hasn't yet reached a point where recovery becomes more complicated. The more informed you are, the more control you gain over your health decisions. Instead of reacting to a serious problem later, you position yourself to prevent it from escalating. Knowledge shifts you from passive to proactive, from ignoring to addressing, from uncertainty to clarity. Early action matters because waiting allows a manageable condition to quietly progress into something more complex. A varicocele doesn't usually announce itself with urgency, which is why many men delay getting it checked. That delay can lead to increased pressure in the veins, higher scrotal temperature, and gradual impact on sperm quality and testosterone production. Acting early means you're stepping in before those changes become harder to reverse. It starts with paying attention to subtle signs like mild discomfort, a dragging sensation, or visible vein enlargement, and choosing not to ignore them. Getting a proper medical evaluation, often through a physical exam or ultrasound, gives clarity instead of guesswork. Early diagnosis opens the door to simpler management options, sometimes even avoiding the need for more invasive procedures later. It also protects long-term fertility potential, which can decline silently over time if the condition is left untreated. Taking action early isn't about fear, it's about control. It's a decision to prioritize your health before complications build up. It shifts the mindset from reacting to problems to preventing them, giving you a stronger position to maintain your physical well-being and confidence. Fertility connection with varicocele goes deeper than most people realize, because it directly affects how the male reproductive system functions over time. It is not just about discomfort or visible changes, but about the internal environment where sperm is produced when blood pools abnormally in the scrotal veins. It raises temperature beyond what sperm cells need to develop properly. This subtle increase in heat can gradually reduce sperm count, motility, and quality without causing immediate alarming symptoms. Many men do not connect fertility issues with varicocele because they assume everything feels normal on the outside. The truth is that reproductive health can decline silently over months or even years. If ignored, even testosterone production can be affected in some cases, leading to reduced energy, libido, and overall vitality. This is why early recognition and evaluation becomes essential, especially for men planning future fatherhood. Medical evaluation, such as ultrasound, helps identify severity and guide appropriate treatment options before long-term damage sets in. Treatment can improve circulation, restore healthier testicular conditions, and support better reproductive outcomes. Understanding this connection changes how men view what seems like a minor physical issue into something that carries deeper biological consequences. It shifts attention toward proactive health choices rather than delayed reactions. Fertility is not only about capability, but also about preserving optimal conditions within the body over time. Small physiological imbalances, if ignored continuously, can influence long-term reproductive potential more than expected. That is why awareness becomes a protective factor in maintaining reproductive strength. Men who understand this early often approach diagnosis differently and are more likely to seek evaluation without hesitation. This proactive mindset can make a significant difference in preserving fertility outcomes and avoiding unnecessary complications, because once damage progresses too far, the natural recovery capacity of the reproductive system becomes limited. Early intervention therefore supports both physical recovery and long-term reproductive stability. It also reduces uncertainty around future family planning and overall male health. Understanding the fertility connection ultimately encourages responsibility toward internal health systems, leading to better decisions about treatment timing and long-term outcomes over time. Progress, treatment options exist for varicocele repair, and understanding them gives clarity instead of fear or confusion about what comes next. Many men assume surgery is the only path, but the reality is that management depends on severity, symptoms, and fertility goals. In mild cases, doctors may recommend monitoring, lifestyle adjustments, and regular checkups to track any progression. This approach focuses on observation rather than immediate intervention, especially when symptoms are minimal or fertility is not currently affected. In more noticeable cases, medical procedures become relevant, and there are established techniques designed to improve blood flow and reduce pressure in the affected veins. One common approach is microsurgical varicocelectomy, where the problematic veins are carefully sealed or removed while preserving surrounding structures. Another option is embolization, a minimally invasive procedure where a small coil or solution is used to block abnormal blood flow, redirecting circulation through healthier pathways. Both methods aim to restore a more balanced temperature environment in the scrotum, which supports better sperm production conditions over time. Recovery and results vary from person to person, but many experience improvement in symptoms and reproductive parameters after treatment. What matters most is not rushing into decisions blindly, but understanding that solutions are available and tailored to individual needs. Consulting a qualified specialist ensures proper diagnosis, accurate grading of the condition, and guidance on whether intervention is necessary. Treatment is not just about fixing a physical issue, it is about protecting long-term reproductive health and preventing further deterioration. It also brings psychological relief because uncertainty often causes more stress than the condition itself. Knowing there are structured medical pathways available helps shift the mindset from worry to action, from hesitation to informed decision-making. In many cases, addressing varicocele can improve comfort, restore confidence, and support overall hormonal balance, which influences energy levels and daily well-being. The key is recognizing that waiting without information creates unnecessary risk, while understanding options empowers better control over health outcomes, especially when future fertility or physical performance is a concern, and having clarity allows men to engage with treatment at the right stage, instead of reacting too late when complications have already progressed beyond simple correction possibilities. Confidence restoration after dealing with varicocele repair is not just a physical shift, it is a deeper internal reset that affects how a man carries himself in everyday life. When someone lives with a condition that impacts comfort, appearance, or even fertility awareness, there's often a quiet layer of self-doubt that builds over time. It may not always be visible, but it influences posture, mindset, energy, and even social behavior in subtle ways. Many men start questioning their body, their future, and sometimes even their masculinity without openly admitting it. That internal pressure can become heavier than the physical symptoms themselves, especially when uncertainty about reproductive health enters the picture. Once diagnosis happens and treatment begins, something important starts to shift mentally. The clarity alone reduces a huge amount of psychological burden because guessing is replaced with understanding. Knowing what is happening inside the body brings back a sense of control that was previously missing. During recovery or after successful treatment, small changes begin to feel significant again, like reduced discomfort, improved physical ease, and a lighter sense of presence in daily movement. That physical relief often translates directly into emotional relief, creating space for confidence to return gradually rather than all at once. There's also a strong connection between hormonal balance and mental state, so when circulation improves and the reproductive system is functioning under healthier conditions, energy levels and mood stability often follow. This creates a feedback loop where physical improvement supports mental strength, and mental strength reinforces healthier habits. Confidence is not rebuilt through a single moment, but through repeated experiences of feeling normal again without pain or concern in the background. Men often notice they become more engaged in life, more focused at work, and less distracted by internal worry that once occupied their attention. Intimate relationships can also improve because anxiety around performance or fertility concerns begins to fade, allowing more natural connection without mental interference. The most powerful part of this restoration is not just returning to a previous version of self, but building a stronger awareness of body health that did not exist before. There is a shift from ignoring signals to respecting them, from avoiding medical attention to addressing issues early. This change in mindset becomes part of identity moving forward, influencing future decisions about health, lifestyle, and prevention. Confidence grows when a person realizes they took responsibility and acted instead of delaying, especially when the outcome leads to improvement and stability over time. And this sense of regained control starts reflecting in how decisions are made in everyday situations, how challenges are approached with less hesitation, how physical awareness becomes sharper, how small discomforts are no longer dismissed but observed with attention, how conversations about health feel less uncomfortable and more natural, how long-term thinking becomes stronger than short-term avoidance, how personal discipline starts to extend into other areas of life beyond just medical recovery, how motivation to maintain fitness and circulation health becomes more consistent, how reassurance replaces fear when thinking about future fertility or performance, how internal dialogue shifts from doubt to responsibility, how confidence stops being dependent on uncertainty and starts being built on action taken, how the body is no longer seen as unpredictable but something that can be managed and supported with the right steps over time. Long-term health impact of varicocele repair is not just about immediate relief from discomfort or visible symptoms, but about how the body continues to function and adapt over years after intervention or even after proper management begins, because the condition itself is rooted in blood flow imbalance that can quietly influence multiple systems connected to reproductive health, hormonal stability. And physical endurance. Weak circulation in the affected veins does not remain an isolated issue. It can gradually influence temperature regulation in the scrotal environment, which is critical for sperm development. And over time, this imbalance can affect sperm quality parameters such as motility and concentration, which are not always immediately noticeable, but become more relevant when long-term fertility outcomes are considered beyond reproductive aspects. There's also a hormonal dimension where testosterone production can be influenced in some individuals depending on severity, and this can subtly reflect in energy levels, motivation, muscle recovery, and even mood regulation, creating a chain effect that extends beyond what is initially assumed to be a localized vascular condition over years. Untreated or poorly managed varicocele may contribute to progressive changes that are not always linear, meaning symptoms can remain stable for a while and then shift in intensity depending on physical activity, heat exposure, or natural progression of venous pressure, which is why long-term observation becomes an important part of understanding how the condition behaves in different individuals. Medical intervention, when needed, can alter long-term outcomes significantly by improving circulation pathways and reducing abnormal pressure buildup, which in turn creates a more stable environment for reproductive function. And many individuals notice that improvements are not only physical, but also reflected in overall vitality and consistency of bodily performance over time. Long-term awareness and follow-up therefore become essential not just for those experiencing symptoms, but also for individuals who have undergone treatment, because recurrence prevention, lifestyle adjustments, and ongoing monitoring all contribute to maintaining results. And this creates a mindset where health is continuously observed, rather than only addressed when discomfort becomes noticeable. Long-term impact also extends into how individuals reshape daily habits once they become aware of how vascular health influences reproductive and hormonal stability, because lifestyle choices such as physical activity, hydration, sitting duration, and heat exposure all play subtle roles in either supporting or worsening venous pressure dynamics. And over time, these small decisions accumulate into noticeable differences in overall system balance. There is also a psychological layer where long-term awareness changes how men interpret physical sensations, reducing unnecessary anxiety while increasing informed attention. And this shift helps differentiate between normal variations and meaningful signals that require evaluation, which gradually builds a more responsible relationship with personal health monitoring over extended periods. Over extended timelines, the impact of varicocele repair or management is also influenced by how consistently follow-up evaluations are maintained, because even after successful treatment, the body continues to adapt to changes in circulation patterns, and this adaptation phase can reveal gradual improvements that are not immediately visible in the short term, especially when sperm parameters and hormonal markers take time to stabilize. At the same time, individual variability plays a major role in determining long-term outcomes, meaning that two people with similar severity may experience different recovery trajectories depending on genetics, lifestyle discipline, and responsiveness to treatment, which is why generalized expectations often fail to capture the full complexity of long-term progression. Continuous monitoring and adaptive decision making therefore become part of a long-term strategy, where the focus is not only on resolving current symptoms, but also on maintaining stability across future years, especially in contexts where reproductive planning or overall hormonal balance remains a priority. And this ongoing attention to internal vascular health encourages a more proactive rather than reactive approach, where small physiological signals are recognized earlier and acted upon with greater awareness, leading into continuous observation patterns and ongoing health alignment without interruption and adjustment process.